Okay, now I want to talk about the femur. The femur is the longest and the strongest bone in body. The head of the femur articulate with acetabulum and making the hip joint, and the neck of the femur is common fracture site in our body. The first of all, I want to describe the classification of the femur. In anatomy, we divided the femurs in three parts: the upper end, the body, and the lower ends. As you see here, in the upper end, we have a head, neck, and two trochanter, greater and lesser. Greater and lesser trochanter, you can see here. And here, this is a head, neck, and this is greater trochanter and lesser trochanters. Okay. The first of all about the head form more than half a sphere and is directed medially upward and slightly forward, as you see in these pictures. The neck, it has about 3.5 centimeter long. It has two borders and two surface. In this picture, you can see that here. You can see that anterior surface of the head here, and at the opposite side is posterior, upper end, and lower borders. And in the junction or the meeting of the head with the trochanter, in the anterior view, the one uh, structure is formed. That name is uh, here. It means that here, in the junction of the head with the body in the anterior view, you can see that the one line, that name is intertrochanteric line. Intertrochanteric line. In the posterior surface, again in junction the neck with the upper end of the body, we have a large elevation. That name is intertrochanteric crest. Okay, we have two new terms: intertrochanteric line in the anterior view of junction of the neck with the upper end of the body, and the intertrochanteric crest in the junction of the upper end of the body with the neck in the posterior surface. On the about a little in about middle of the intertrochanteric crest, we have a more elevation here. It's a part of the intertrochanteric crest. That's name is quadrate tubercles. Okay. About the trochanters, the greater trochanter is like a greater tuberosity in the humerus. The greater trochanter is quadrangular at the upper end of the junction of neck with shaft, you can see here. And this trochanter has one apex, the upper part is apex, and three surface. The lateral, this one is a lateral surface. You can uh, touch in your body because usually it's subcutaneous. The medial surface is look, this surface look at to the heads, and the anterior surface. This is the anterior surface of the greater trochanter. The lateral, medial, anterior surface, and apex. In the medial surface, we have one important point. In the medial surface, we have one small fossa. That name is trochanteric fossa. This fossa is important for attachment of some muscles, and I will tell you in next lectures. And the lesser trochanters is situated medial and posterior in junction of shaft with uh, neck. Again, this trochanter is site of attachment and insertion of the one important muscle. That name is uh, iliopsoas muscles. The insertion of the iliopsoas muscles attached to the lesser trochanter. Okay, another part is a body or shaft. Body or shaft. In the one middle of the femur, it means that here the body is uh, uh, more or less cylindric. It's northwest in the middle. This is the northwest part in the 1/3 middle. In the middle 1/3, the femurs, if I doing a cross sections here, for example, this is a cross section from the femurs. This is the anterior. This is the posterior. The lateral and medial. We have a three surface: anterior surface, medial surface, excuse me, lateral here, and medial surface. And we have a three border: medial border, lateral border, and posterior border. And in conclusion, we can say that the femur in the middle 1/3 has three border: medial border, lateral border, posterior border, and three surface: anterior, medial, and lateral. The posterior border is important because posterior border is more detectable if you compare to another borders, and its name is a lina aspera. You can see here, this is a lina aspera. Aspera means rough. The lina aspera has two lips or two borders. You can see here, this one is a one lip or one border. I detected here, and another borders. This is another lips here. It means that has two lips, medial or lateral lips. Okay, it means that it has two lips. And if you continue the lina aspera into up and down, you can see that in the 1/3 uppers, the two lips of lina aspera separated or converge from each others and making two new definition terms. Okay, in the medial lips, when go to ops, making a new definition terms here, and again this one go up. Okay, it means that when you follow lina aspera, this is a lina aspera, for example, has two lips, go up and medial and go up and lateral. Okay, here is more prominence in lateral side. The medial, that name is spiral line, spiral line, and that line go to the upward and lateral. His name is gluteal tuberosity. This one is a gluteal tuberosity, and this one is a spiral line. As a result of this separation, the another surface, the fourth surface, making in here between these two lines, small surface in here. In the lower part, again, the two lips of Lina aspera separated from each other in a 1/3 lowers, like these pictures here. Excuse me. You can see in the pictures here, in this line and this line, separated from each other, like my pictures. We say that lateral supracondylar and medial supracondylar. This is a medial supracondylar line, and this one is a lateral supracondylar line. And here in the 1/3 lower, the another surface, the fourth surface is formed. We say that this is a patellar surface. Excuse me, popliteal surface. Popliteal surface. Okay, popliteal surface here is formed between two medial and lateral supracondylar line. Okay, that's all. In conclusion, we say that in the 1/3 medial we have a tree surface, as you see these pictures, but in the 1/3 upper and 1/3 lower we have a four surface, because in the 1/3 upper and 1/3 lower the lina aspera separated from each others. Okay, that's all about the body of the femurs. And in this picture you see that the close up of the upper end, you can see that the head, the neck, superior greater trochanter and lesser trochanter, this is the anterior view, and this one is an intertrochanteric line. In the posterior surface, exactly in here we have a intertrochanteric crests. In here you can see that the head of femur, in the a little below the middle of the head, we have a small cavity. That name is fovea capitis. You can see here, these pictures, this area, we have one small, that's fovea capitis. The fovea capitis attached by one ligament, that name is ligament of head of femurs, to the floor of the acetabular fossa. You can see here the ligament of head of femurs. And again, in this picture, you can see that the capsule of the hip joint that attached to the intertrochanteric line here, this is a capsule of the hip joints. Okay. Another point that you can see in here, we have one angles and normal angles between the axis of the long axis head and necks here, the dot point. This is a long axis of the head and necks. And here is a long axis of the shaft. Between these imagination lines, we have one important angles. That name is angle of inclination, or neck shaft angle. Another name is neck shaft angle. The usually it is about 125 degrees, and this degree is important for the sufficiency of the some muscles around the femurs. Then normally we have a some angle in here. As you told you, this is a neck shaft angle in here, the about the 125 degree, but in the some normal or pathological, maybe this angle increase or decrease. For example, here you have a decrease in the angle of the inclination around 105. This is name is Koksawara, and this one is again excess or increase in the angle. That name is a Koksawalga. Okay, in the some cases, like a child before the weight bearing, we have a Koksawalga with increase of the age in adult we have a normal, in the senile person we have a coxavara, and change in this angle of inclination has a direct effect of the some important muscle around the femur, like a gluteus medius, and we have some pathological position in the change of this angle. I will tell you in the soft tissue anatomy. Another angle here, this angle of torsion between the upper end of the femur. It means that the one long axis that pass through the head and necks, this angle with the lower end axis that pass through the condyle of the femurs, uh, usually normally making a normal anteversion around the 15 degree. If we have an excess anteversion or retroversion or excess anteversion, uh, we have some pathological position, usually excess anteversion accompanied with the intoi. If you look at the shoes, this is an intoi that the foots, two foots look each other, and we say that the intoing. Okay, uh, here this is a uh, some important attachment to the trochanter, especially the greater trochanter, the lateral surface, the gluteus medius and minimus. Especially medius is important muscles that's attached to the greater trochanter. This is some another things about the femur, and you can see that. Now I want to talk about the lower end of the femur. The lower end is widely expanded to form two large condyle. It's like a condyle in the humerus. Anteriorly, the two condyle are united, and posteriorly, they are separated by deep gap terms intercondylar fossa or notch. You can see here anteriorly two condyle joined together and posteriorly separated by intercondylar fossa or intercondylar notch. At the anteriorly, you can see that we have one articular surfaces here between two condyles. This is the name of this articular surface is a patellar surface. Or we say that the anterior surface is a patellar, or the tibial. The patellar surface, that one that you can see here, this is a patellar surface. The patellar surface cover anterior surface of both condyle and extended more on lateral condyle than medials. And this surface articulate with the posterior surface of patella and making the patellar femoral joints. The another surface in the tibial surface, that name is a tibials. The tibial surface is made by two condyle to cover inferior and posterior surface. You can see here, excuse me, you can see here, the extended in the inferior to the posterior surface. You can see more this area more than here. This is a posterior surface extended from the inferior to the posterior surface. The lateral tibial surface take greater part in the transmission of the body weight to tibia. If you look at the pictures, you can see that here the one is extended. We have a more wide bearing from the lateral sides. The transmission of body weight usually and take place on the lateral condyle, and this lateral condyle less prominence than the medial. It is stronger. Um, we have a one prominence, that name is lateral epicondyles. Here you can see that the lateral epicondyles here. This is a lateral epicondyles, and in the inferior surface of the, or inferior to the lateral condyle, we have a one groove, that name is a popliteal groove below the epicondyle. And the medial condyle, most prominence, you can see it if you compare the medial condyle prominent point is called medial epicondyles. Like a lateral condyle, we have a one uh, prominence part, that name is a medial epicondyle. Posterior superior to the medial epicondyle, we have a one spatial area or spatial elevation, that name is this one, excuse me, this one, his name is adductor tubercles. The insertion of the adductor magnus, one of the important muscles in the medial side of the thigh, is adductor magnus muscles attached to the adductor tubercles. This is a lower end of the femur, and for more information you can read these slides. I told you all of them. You can see here again the lower ends. Again here you can see that this is a popliteal surface, that the one popliteal muscle attached to here. This is the intercondylar fossa or notch. The cruciate ligaments, I will tell you in the soft tissue, the cruciate ligament attached to the wall of this intercondylar fossa. Here this is a patellar surface. That is important. Now we have some clinical point. As I told you, the neck of femur is the most frequently fractures because it's lowest and weakest part of the bone here, and usually take place in the older person. And if it's broken, we have some lesion in the blood supply of the neck, and maybe the neck of femur be necrosis. The fracture of the body or the shaft of femur is a rare condition because, as I told you, the femur is the strongest bone in our body and usually take place in severe accidents. And another thing is fracture of femoral neck often disrupt the blood supply to head of femur again. Most of the blood to head and neck of femur is supplied by medial circumflex femoral artery. I will tell you in the next lecture. And the patella, as you see here, the patella is a large uh, irregular bone, is the largest sesamoid bone in our body. Is it's subcutaneous. You can touch it in front of your knee. The patella has two surfaces and one base and one apex and two border. In this picture you can see here, this is the anterior surface, this one is a posterior surface, the lower, the medial and lateral borders, base and apex. The posteriorly, the articular surface is most divided by one vertical line here in two area. This is a imagined one vertical lines, and usually the posterior surface, as I told you, articulate with the patellar surface of femur and making the patellofemoral joint, and the quadriceps muscles. That muscle situated in front of the thigh is named the quadriceps. As a name, the quadriceps has four heads. The quadriceps muscles attached to the uh, patella, and after passing through the patella, attached to the anterior tuberosity of tibia. Okay, that's all for this session. In the next session, I will talk about the tibia, fibula, and the foot ankles.